The stronger your body is going into an operation, the easier it is to get up and moving after it. Ideally, if you're able to start an exercise program 6 to 8 weeks before your surgery that includes walking at least 30 minutes per day, as well as standing up and sitting down at a chair 10 times, holding onto a support such as the kitchen bench and raising up onto your toes approximately 30 times, and standing approximately 40 centimetres away from the wall, pushing up 10 times against the wall. Do each of these exercises 3 times a day. If you are new to exercise, please start slowly and build up the number of exercises you do, as well as the heaviness of the weight that you do to reduce the risk of injury. Also, you can talk to your GP if you haven't exercised for a while. Please stop if any of the exercises are causing you pain, although some discomfort when exercising is common and soreness in the muscles afterwards is also normal. You should speak to your physiotherapist or exercise physiologist about how you can be as active as possible in the weeks prior to your surgery. Remember, any exercise is better than no exercise, and even if you can't start 8 weeks before your surgery, but only 1 week before, every bit will help.
For all people undergoing surgery, to assist you with your recovery, please speak to your GP about ensuring your iron levels are high enough before your surgery. Having low iron when going into surgery can slow your recovery, make you more likely to need blood transfusions, stay in hospital longer, and increase your risk of getting an infection. Make an appointment with your GP as soon as you can to get your iron levels checked.
Just as it is important to prepare your body for surgery, it is also important to prepare your mind. It is very normal to feel anxious, stressed, or scared. The more information you have, the more prepared you will feel. Top tips to help you feel emotionally prepared for surgery include talking to your surgeon or GP about any worries or concerns you might have. No question is a silly question. If you're unsure of anything, prepare a list of questions or write information down so you can refer to it later. Read information and instructions carefully so you know what to expect. Prioritise self-care in the lead up to your surgery. Things like trying to get a good night's sleep, eating well, and avoiding stressful situations where possible. Identify stress management tools that work for you and use them. For some people, this might include exercise like yoga or stretching, deep breathing, visual imagery, progressive muscle relaxation, music, art, or journaling, to name a few. You might find apps like The Smiling Mind or Headspace helpful. On the day, bring items that can occupy your mind whilst you're waiting, such as books, magazines, music, or puzzles. And identify your support network, people you trust and feel you can talk with honestly, and people you can lean on for help.
By preparing your mind and body for surgery, you can give yourself the best chance of recovery. Remember, eat well following the Australian guidelines to healthy eating, exercise to make your body stronger, stopping or reducing smoking, alcohol and other drug use, checking your iron levels with your GP, and preparing your mind are things that you can do to make yourself as ready as possible for your upcoming surgery.